Microneedling is a super popular skin treatment, and for good reason. It can stimulate collagen, it can help with scarring, and it can do so much more. So today, I'm going to tell you all about it. I'm Dr. Sam Ellis, and I'm a board-certified dermatologist. I'm here to help you understand your skin and find products that work for you. If that sounds good, give this video a thumbs up and don't forget to subscribe to the channel. Microneedling does have some medical uses, which I will touch briefly on later in this video, but it is principally used as a cosmetic treatment. So that's what I'm primarily going to focus on today. So what exactly is microneedling? It's a minimally invasive procedure that uses very tiny sterile needles to repeatedly prick the skin over and over again with the main goal of inducing collagen production. It sounds kind of barbaric when you say it that way, but really what you're trying to achieve with microneedling is a controlled micro injury of the skin, because this will induce a wound healing cascade. And one of the things that happens when your skin is healing from a wound is that it produces new collagen. So this can be really helpful for treating things like acne scarring or even fine lines or wrinkles, as well as irregular skin tone and texture. Microneedling is also known as skin needling, collagen induction therapy, or percutaneous collagen induction. When it comes to microneedling devices, there are a few different categories. So most traditionally is a derma roller. This is a manual device that's essentially a little cylinder that has needles projecting out from it, and it's rolled up and down and across the skin to induce those micro injuries. What's more commonly used in a dermatology office is an electrical microneedling pen. So this is a little pen that has needles jutting out from the tip of it. It has a lot more precision and control because you can change how fast the device is going, as well as how deep the needles are penetrating. And then lastly, there's radiofrequency microneedling devices, and this combines radiofrequency energy with microneedling. So you're not just injuring the skin with the microneedles, but you're delivering heat with those microneedles as well, so the injury can be a little bit more powerful or more robust. You may have also heard of microneedling with PRP or microneedling with platelet-rich plasma. This has been trademarked as the vampire facial, but essentially that is a microneedling treatment followed by application of platelet-rich plasma to your skin. Because microneedling has been shown to consistently improve collagen production and also elastin production, which helps with things like skin laxity, it has a really broad array of applications and can help with many different skin conditions. Like I mentioned a little earlier on in this video, probably the most common application for microneedling in a cosmetic setting is to improve the overall texture and tone of the skin. So someone coming in saying, hey, I have these enlarged pores, my skin doesn't look as glowy as it used to, I feel like it looks a little bit dull or sallow. Microneedling can be a great intervention for all of those things. And it has the ability to improve the appearance of stretch marks. There are some smaller studies that show that microneedling can be helpful for certain types of hyperpigmentation, such as melasma, and then there are medical applications for microneedling as well. For example, microneedling has been shown to improve certain types of hair loss, like androgenetic alopecia, also known as male pattern or female pattern hair loss, as well as alopecia areata, which is more of an autoimmune mediated type of hair loss. You can also think of microneedling as a way to deliver certain medications or drugs deeper into the skin where they might exert more potent effects. Now, when it comes to having a microneedling treatment performed, I strongly recommend that you have it performed in a clinical setting and not at home. I mention this because there are at-home microneedling devices. And if you're someone watching this who performs their own at-home microneedling treatments and have had really good success with it, that's great, but I have seen some disastrous outcomes from at-home microneedling, most commonly infections, but also some pretty bad scarring. That's not to say that a professional microneedling treatment doesn't come with similar risks, but at-home devices tend to have duller needles. They're also hard to sterilize or keep clean. And also you can't really change the depth of microneedle that you're using, and different areas on the face require different depths of needles. And if you're not getting a really tailored treatment, you have a higher risk of a poor outcome. Okay, I will get off my soapbox about at-home microneedling, but now let's move on to what you can kind of expect when you come in for a microneedling treatment. Of course, this is going to vary a bit between where you're getting treated, what kind of setting you're getting treated in, but this is the general gist. Because microneedling involves puncturing the skin surface over and over again, it can be a really uncomfortable procedure if you're not numbed ahead of time. So I would say the vast majority of clinics that administer microneedling will give you topical numbing cream 20 to 60 minutes before your treatment to make it a very comfortable procedure. Once you're numb, you don't really feel much at all, except sort of like a slight vibrating sensation. The one caveat to this would be radiofrequency microneedling, which remember uses heat and microneedling. That can be a much more uncomfortable procedure. So sometimes injectable numbing is also needed to make that procedure tolerable. After you're numb, the treatment typically takes 10 to 30 minutes, depending on which areas are being treated. I would say most commonly it's the face, but microneedling can really be used anywhere on the body. Once the treatment is complete, the skin usually looks pretty flushed and you often will see pinpoint bleeding. And that's because the goal of microneedling is to reach the dermis, that second layer of skin, and that's where the blood vessels are. When it comes to recovery or healing after a microneedling treatment, that is going to vary so much based on the type of treatment that was done, how aggressive it was, as well as your own unique ability to heal from an injury. Downtime can be as little as 1 to 2 days with just some slight flushing or bronzing of the skin, or maybe it has a slight sandpaper texture, but recovery can take several days if a deeper or more aggressive treatment was done. Recovery from microneedling really shouldn't be painful at all. I always tell my patients, you're going to look a lot worse than your skin feels. And when it comes to taking care of your skin after a microneedling treatment, every clinic is going to have a slightly different protocol in terms of what they want you to do regarding cleansing, moisturizing, protecting from the sun, which is very important, but they might have certain products that they want you to specifically use. For example, in my clinic, I want my patients doing very, very gentle skincare while they're healing from their microneedling. So a very basic cleanser, a very basic moisturizer, sometimes a topical steroid if I'm concerned about pigmentation or them having a really intense inflammatory response to the treatment, but it's very basic. I recommend a mineral sunscreen for the week after their treatment, and I really don't want my patients wearing makeup for at least a couple of days after their procedure. I should also mention that different providers may want you to prep your skin in various ways for your microneedling treatment. I don't have my patients stop their antioxidants or their growth factors or their retinoids ahead of time, but some may ask you to do that. Also, if you're prone to cold sores, you may be asked to take antiviral medication ahead of time to prevent any cold sore flares that could happen from a microneedling treatment. Maybe the most important thing I'm going to say in this entire video about microneedling is that more than one treatment is needed. Typically, a series of 3 to 6 treatments spaced about a month apart are really what is required to see meaningful results. I say this because it is not uncommon for patients to come to me for a cosmetic consultation, and when I'm inquiring about their treatment history, they'll mention that they've had microneedling done and that it did nothing for them. But then when I delve a little bit more into what their treatment was like and their duration and their follow-up, they tell me that they only had 1 or 2 treatments. And that's really not going to get you exciting results. Okay, I kind of take that back because maybe after 1 treatment, you'll have a little bit more glow, the skin will look a little less dull. That's true, but if you're trying to treat like real texture or scars or really get that collagen revved up, you need a series. The other thing that's worth mentioning, and this is really true of all cosmetic procedures, is your outcome is highly dependent on who is performing your treatment. What's their technique? What's their experience? How are they having you prep your skin? How are they having you take care of your skin afterward? This all matters. One thing that's really nice about microneedling, aside from its ability to create meaningful improvements in a variety of different skin conditions, is that it is quite safe in all skin tones. So in cosmetics, there are a lot of devices that are not as recommended for deeper or darker skin tones because the heat from those devices can cause irregular pigmentation and is more likely to cause scarring. But because microneedling, just plain microneedling without radiofrequency, does not use heat, the chance of an adverse outcome just because of someone's skin tone is really, really low. Now, if you're someone who reads a lot about different cosmetic procedures or just takes in a lot of information about all the cosmetic treatments out there, you may realize that a lot of these treatments have very overlapping effects. For example, microneedling and lasers and tightening devices and chemical peels can all be used to address similar skin concerns. So how do you know if microneedling is the right treatment for what you're dealing with? And this is where a cosmetic consultation really comes into play. It's also why I really encourage people out there who are seeking out cosmetic treatments to have a cosmetic consultation with someone who has access to all of these devices. Because of course, if you go somewhere and the only cosmetic intervention they offer is microneedling, guess what they're going to be recommending for whatever you're coming in with? Microneedling. But if they have lasers and they have tightening devices and they have injectables, they are really going to be able to make a very tailored treatment plan and really recommend microneedling only if it's the best intervention for what you're coming in with and what your other concerns may be. Just a note on people who should avoid microneedling: if you have certain skin conditions that get worse with trauma to the skin, for example, vitiligo or psoriasis, I would probably recommend steering clear of microneedling. Also, if you have active inflammatory acne or you have any other type of infection on your skin, like a cold sore outbreak, you need to avoid microneedling while you're flaring. The final thing is if you are prone to keloid type scarring, so that exaggerated excess scar tissue formation, I would definitely avoid microneedling. Because microneedling is such a versatile cosmetic tool, I love having it in my arsenal of things that I can offer to my patients. But again, that's why we have the cosmetic consultation, to make sure that it's the right thing for the patient based on their timeline, their budget, their concerns, their expectations, etc. Have you had microneedling? Tell me about your experience in the comments. Don't forget to like this video and subscribe to the channel, and I will see you next time.